Turning to your health watch now, remembering that COVID isn't the only health concern.
Local 5's Connie Feldman introduces us to a breast cancer survivor and shares her message about early detection.
We've all heard the mantra, early detection is the key to fighting cancer. But what if that early detection comes on the eve of a pandemic? Should you wait? Can you wait? One local breast cancer survivor tells us her story. As a medical professional herself,
Being a nurse, I'm like, oh no, am I going to be put on hold for 6 months?
and a proud owner of a therapy dog,
We would take him to the nursing homes, we would take him to the hospitals.
Denise Hess was used to caring for others. So when she got news after a routine mammogram that she had breast cancer,
I felt like I got punched in the gut, to be very honest with you.
the timing couldn't have been worse.
On the 18th of March is when the governor shut the whole state down. And I was told that I had invasive ductal carcinoma.
Despite all that, Denise says she now actually feels thankful.
It was so small. They were like, well, we're not really sure if this is anything, but it wasn't here a year ago, so we're going to biopsy it. And I'm so grateful that they did.
Aurora BayCare Medical Center breast surgeon Dr. Cynthia Chao says Denise is a perfect example of why it is so important for women to get yearly mammograms.
The earlier you detect things, the more lives you're going to save.
And not just women with a family history of breast cancer.
90% of women that get breast cancer have no family history.
Denise wasted no time moving forward with treatment.
I immediately hung up the phone and went to see my boss and said, I got to go. I got breast cancer. And I just flew out of this place.
And her own personal nurse, called a cancer navigator, wasn't far behind.
I wasn't even to my car yet. And Diane, the nurse navigator, was on the phone saying, okay, I know this is a really bad time. We're going to get through this. And it was fantastic.
A cancer nurse navigator is just one of a whole team at Aurora BayCare that comes together for cancer patients.
If you are worried about cancer, if you're worried about anything right now, it's okay. We've got an entire team to help you.
For Denise, that team made all the difference.
From her to the genetics counselor to my surgeon to radiation, I had the best experience.
Dr. Chao says making patients feel that comfortable, even amid a health crisis, is a top priority.
Everybody will come together to support you and help you and get you through this. Even during a pandemic, it's possible.
Now, as a cancer survivor, Denise says she's looking forward to the pandemic being over when she can be with family and friends again. In the meantime, she says she wants to get the message out about how important it is to be vigilant about your own health care.
I already have my mammograms scheduled for next year.
Another option Aurora BayCare offers right now to help patients feel safe is virtual check-in. So you don't even have to sit in a waiting room with other patients. They just give you a call when your room is ready and you go right in. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Connie Feldman, Local 5 News.